Welcome to the COVID-19 Physician Learning Series, brought to you by Jewel and the Canadian Medical Association. I am Dr. Gillian Horton. I'm a general internist, medical educator, writer, and I'm your host for this series as well. As this crisis evolves, some of our healthcare systems are being flooded with staggering numbers of critically ill patients. Doctors and nurses describe those scenes as war zones and battlefields. While this experience may be foreign to us, its overtones have sounded all too familiar to Lieutenant General the Honourable Roméo Dallaire. I am privileged today to have the opportunity to have a second conversation with him, this time in French. In today's conversation, it's our intention to highlight powerful emotional and moral lessons learned from General Dallaire's distinguished military career, including his time as Force Commander of the United Nations Assistance Mission for Rwanda during the 1994 genocide. General Dallaire will also offer us key insights into managing our post-crisis risk of occupational stress injury and also PTSD. General Dallaire, it's an honor to be speaking with you again today. The pleasure's all mine. We discussed this in our English interview last week, but for anyone who's younger and perhaps not familiar with what transpired in Rwanda, could you briefly give a sense of the absolutely impossible circumstances under which you served there? Well, Rwanda was supposed to be an easy mission, a classic peacekeeping mission, if you like. But what we failed to understand, really, was that the extremists didn't want peace. So the situation degenerated over a space of about 6 months. There were negotiations during that time, murders, riots, and at the end of it all, the president's plane was shot down. And then we ended up in a civil war and a genocide situation as well. The UN mission was not equipped and didn't have a mandate to react. We lost soldiers right from the outset, right from the first day, in fact, and countries taking part in that mission decided to withdraw the troops. So I ended up with about 450 troops facing off against more than 10,000 militia, and they'd been brainwashed to kill all Tutsis across the country. So for 3 months, with no support from the outside, except for 12 Canadians who came in as reinforcements, we tried to mitigate the impact of the civil war. On the one hand, of course, there were truces along the road as well, and we tried to protect more than 32,000 Rwandan citizens from being massacred. But in the meantime, there were more than 800,000 who were killed, and more than 4 million actually became refugees. We're seeing an endless stream of doctors and healthcare professionals on social media and in the news putting forth their stories for public consumption. There are stories about what's happening in hospitals right now. In your writing, you talk about a phase in your life where telling and retelling the story of the genocide and your role in it became an obsession. How can we work the most effectively with the public, sharing of our experiences without it veering into a territory where maybe that impulse is not so healthy? Well, it's essential for people not to ignore the experience that they're going through and the experience they've gone through, be it ordinary people and the restrictions, the lockdown, even after they've gone back to their regular lives, but also for those on the front line, in the firing line, if you like, medical professions, more specifically security forces as well, but especially those working in the health service, especially those who face moral conundrums because they're overwhelmed. And we're seeing this already. And also because they don't have the necessary resources to deal adequately with what patients need. So they have to make decisions. That complex and emotionally charged period, an experience where physicians are required to continue to do their job. Well, during that period, physicians will need proper communication. They'll need to be able to talk to their peers, but also to society at large. So their organizations must also be able to allow them to speak out about what's happening, about their experience. And then after the event is over, they must be able to actually work through the experience without throwing them into crisis. But they can't close down. That has to be avoided. They can't just close down and keep everything inside, because they'll never deal with what they've gone through if they do that. If they quite simply close down and refuse to talk about it, throw themselves into the job, just say, well, I can deal with it, I can take care of myself, no, I'm the only one going through this, I'm not going to talk about it. That type of approach, it has to be stopped and prohibited. You have to encourage them to talk. In Waiting for First Light, you talk about a powerful moment where you were gazing at a child who was the same age as your son back home. You say in your heart you had already brought him home and added him to your family. Made me think of how doctors are often taught to cope with the loss through non-attachment, and how toxic and suppressive that can be in the face of great suffering. Especially as many of our colleagues in other centers are supporting patients who are separated from their families during critical illness and death. What counsel can you give on that front, working with the grief and loss in front of us when it's of this magnitude? Well, the situation I went through was awful. I saw so many people dying far from their families. They suffered greatly. And very often they never ever saw their families again. Survivors never saw their families again. And there was also a lot of psychological injury that was caused as well. But in terms of physicians and those working on the ground, those who find themselves in this professionally demanding situation, and those who have strong values, who have a strong, unshakable faith, which comforts them. Well, even for those people, it's impossible to expect human beings to be impervious to those emotions. And I think if physicians focus too much on trying to dampen down those thoughts, it'll make them battle-hardened. It'll put them on the wrong track. All they're doing really is storing up more issues for the future. It's likely they'll become frustrated and that they'll lose their desire to serve. So it can make things actually worse. After the event's over, undoubtedly they'll start feeling guilty, they'll feel that they didn't do everything they should have done. So I think that as Dr. Rubinsky at Doctors Without Borders said, you have to actually experience the event with people, but at the same time you have to recognize that these events are ephemeral. They have a limited duration, and physicians will have to continue to do their job, despite the heavy emotions that they feel. They shouldn't try to neutralize those emotions, but they have to realize that these emotions are normal, but at the same time they can continue to do their job. It's almost as if they had to harness those emotions to demonstrate sacrifice and their dedication to their profession, and also to demonstrate the strong values of that profession as well. So basically, you shouldn't hide from the emotions. It's an ephemeral experience. Of course, emotions will build up, and when the adrenaline fades, when the crisis is over, that's when it's crucial to help them to deal with what they've gone through, with the experience that they've been hard hit by. We talked in our other discussion about the struggle the medical profession faces to prioritize self-management and to discuss invisible wounds. You talked about the intolerance of professions that wear uniforms towards things that aren't absolute. I think you used the word Darwinian. Can you say more about that? Well, any organization with a strong identity, organizations that have clear symbols of what their organization does, be it uniforms, clear standards, its status in society. Well, those organizations put huge indirect stress on individuals to give 100% or even 110%. Now, those bodies, those organizations, are very intolerant of suboptimal performance because they believe that all members of the organization must work together to ensure the success of the organization. Now, the intolerance becomes even more pronounced when injuries or wounds are invisible, because they tend to be very visual organizations, like physicians, for example, they're very visual. So, in that type of context, where there's a drive for high performance, well, individuals can be driven to not reflect outwardly any weaknesses. And that's why it's crucial that physicians be able to voice their issues in a group setting. They must be able to talk to other members of their group. They must feel supported by their colleagues. There must be an ability for physicians to communicate, and physicians must be encouraged to say, listen, I'm tired, I need a rest, and the group around them must support them, must encourage them, and even say, well, no, enough's enough, you need a rest. We can't jeopardize care to patients. That takes leadership. Leaders must be able to see these individuals for what they are. They're basically walking wounded. And individuals must be given the opportunity to speak about their experience, about their issues. It could just be a chat between peers, a quick coffee, something like that. But physicians must feel supported. They must feel supported by their peers, because they won't be able to deal with their issues alone. And they shouldn't be encouraged to think that they have to go it alone. They have to feel supported by their team. And secondly, they have to feel that the country and their families are behind them as well, that the country is supporting them, is thinking about them, is concerned about what's happening to them. They have to feel that. It's something that has to be tangible. They must feel that so that their morale can be maintained. After you served in Rwanda, you took over a role looking after troops' quality of life and what was being done for them. And this was very personal work for you. I saw an interesting parallel between the relatively young movement of physician wellness and how it has often been a subject of disdain, contempt among the old guard. What is the tone you want to see our leadership adopt when it comes to creating a culture where caring for ourselves isn't seen as a weakness? Well, it goes without saying that the organizations we're talking about are very, very conservative, and leaders in those organizations often take an old-fashioned approach. They take the stiff upper lip approach, as the British would say. What does that mean? You hide your feelings, your concerns. Individuals are encouraged to conceal their concerns, to show they're in full control of the situation, while those leaders must be sidelined. They must even be muzzled. And they must be replaced by other leaders, leaders who recognize that invisible injuries exist. People get injured inside. Those injuries are invisible. Those injuries are real. But at the same time, they can be managed during a crisis situations out of a sense of duty, because adrenaline kicks in. But leaders have to realize that they're pushing physicians to the limit. They know they have to realize that physicians face ethical dilemmas, and that there's low morale. Leaders must be clued into what's going on with their staff. We lost many of our soldiers to suicide post-operation. Why? Well, when they were in theater, they had constant support. But as soon as they came home to civilian life, well, that care was delegated to their families and to physicians, and there were times of crisis for people returning from operations. They weren't getting appropriate support, and their emotions bubbled to the surface. And those emotions basically drag many of them down into the depths of a living hell. So, leadership has to closely monitor their staff. They have to give these people a helping hand. They have to listen to them. They have to realize that some need support. They have to create an atmosphere where communication is encouraged. It shouldn't be seen as a weakness to open up about your feelings and say that you're injured. And that was a great innovation in the military, having soldiers realize that it was honorable to be injured on duty, and to have soldiers understand that they shouldn't try to hide their feelings, that they should talk about it, open up about it, and they should seek treatment, and then go back to work, in the knowledge that the issue or the feeling would not go away, and that it would only be dealt with after the end of the mission. I want to talk about the specificity of our experiences. You share a scene from your life where you were assigned to an all-comers therapy group with a therapist who you say you weren't even sure could spell the word Rwanda. And you talk about the criticality of shared knowledge. There is going to be a huge variation in the experience of doctors dealing with this crisis. Some of us will be in operations, some of us will be on the front lines. How do we avoid putting our people in the terrible situation you found yourself in when you first sought help? Well, there's no doubt that if leadership does not recognize that it takes a team effort to help an individual deal with their issues and their feelings. Well, if they don't realize that, it'll create divisions, and those divisions will be very, very harmful in many cases. Some will say, I've done more than you. Some of you have dragged your feet. You haven't been as involved in dealing with this situation. So then there has to be a coming together, reconciliation. That's essential. At the Canadian Legion, I saw situations where First World War veterans refused to speak to World War II vets. The ones that had been in Dieppe, for example, who had fought for 24 hours and then taken prisoner. First World War vets refused to speak to them because they felt that because they'd been taken prisoner, they had a comfortable life compared to those who had continued fighting. So those divisions do develop. But those who have influence over our teams through their leadership role, or because they're an expert, a therapist, for example, they really must really fully understand the culture of the organization. They must be able to fully articulate the impact of the issues on the individual physician. They must understand those issues within the context of the culture of the organization. It's not good enough for those therapists to have to continually be asking questions to understand the culture. No, they must fully understand the profession that physicians work in already. They must understand the setting, and they must be able to pinpoint the wounds that the individual feels. They can't be flailing about trying to understand what's happening, because that'll lead to a loss of trust from the patient, from the physician. And the adverse effect of that is that physicians will be deterred from reaching out for help. They'll turn inwards, they'll stop talking to their colleagues, their co-workers, and they'll self-destruct basically in the end. There's interesting literature in medicine to show that doctors who are perceived as the most compassionate by patients are also at the highest risk of burnout. I suspect that this is true in general on any mission. And yet those are the people who preserve the soul of our profession. But sometimes they do what you talk about, which is suicide through work. What guidance can you give to that portion of our population specifically? Well, I think humanity and compassion are crucial for any person doing a job where they come into contact with other human beings, administrators, technicians perhaps. They have more clear-cut roles and jobs, I think. Well, for them, it's easy not to become emotionally involved. But for physicians, for example, well, they deal on a daily basis with other human beings. Now, these human beings are either alive, sick, or deceased, right? So they can't withdraw. They get emotionally involved. You have to recognize that physicians are above all human beings. First responders have human emotions as well. They need support. Support that's specifically targeted to the trauma they've experienced. The trauma they've experienced during the situation that they've gone through, the event, if you like. I think it's also important to realize that some physicians will be very adept at concealing their need to talk about what they're going through. And that's especially true if the organization has not demonstrated humanity or compassion for its employees and patients. Now, if physicians also feel that their colleagues don't demonstrate humanity, it gets even harder. Now, what happens is that they'll start working harder and harder to conceal their issues and their feelings, the issues that their community sees as weaknesses. So they're going to throw themselves into their job. They're going to work harder and harder and harder. And why do they do that? They do that to self-destruct, but with honor. They give it their all. That's basically what happens. That's what happened to me, in fact. At one point, I realized that I was working 22 hours a day. Why was I doing that? I was doing that to really mitigate the feeling of guilt that I had, and also to avoid having to spend too much time thinking about what happened to me. So that really endangers physicians themselves. So, and one of two things can happen here. They'll self-destruct, they might commit suicide, or they'll just burn out, and then they're of no use to anyone, because basically what they've done is they've upended all the normal standards governing work. And therefore, they're not able to support the team effort. They're not able to support their colleagues. Now, those on the front lines, physicians, healthcare workers, are in the same situation as soldiers. Soldiers train constantly to keep them fighting fit. Why? So they're able to support the team effort, to support their co-workers. So basically, physicians in that situation have to be encouraged to reach out for help. When they feel that their objectivity has been compromised, they must be encouraged to reach out. At the end of my mission, I asked to be relieved of my duties. Not so much because I was a threat, but really because I didn't have the necessary objectivity to continue to command. I realized my objectivity had been compromised. Leaders must be sensitive to that, and they must take action. But also individual physicians. Individuals must really be constantly monitored, so that leaders realize, in fact, that doctors are going through ethical dilemmas, and that they're trying to self-destruct by working harder and harder, literally. General, before we finish, is there anything else you'd like to say directly to physicians and healthcare workers in Canada? Well, at the outset, I think physicians have to recognize that they won't have everything they need to do their mission, to do their job. And secondly, they'll have to recognize that they're working in a country at war. And what they're doing will have an impact on all Canadians. So they have to be able to continue to do their job, to make things better for Canadians. So they have a huge responsibility. But they have a huge asset as well. Professional instinct, gut feeling. They're Canadians, professional Canadians, working, and they have to follow their gut feeling. That's very, very important, I think. That gut feeling is vital. Now, if physicians feel that they've lost the ability to quickly take the measure of a situation, I think it's time for them to take a break so that they can rest and recover. It's the only way that medical professionals will be able to deal with the feelings of guilt that they'll have. They're bound to feel they haven't done enough. They could have done more, but basically they're doing everything in their power to help, but the odds were quite simply against them. General Dallaire, I want to extend my deepest thanks and my gratitude both for your wisdom and your guiding hand, and also your service to our country. While I remain focused on the time after the virus has been beaten back, because that's when the wounds will surface. They will. And I hope to be of some use at that time. Thank you very much. Thank you to you. I'm Dr. Gillian Horton. Thank you for joining us for this COVID-19 webinar series powered by Joule. Take care of yourselves and thank you for all that you do. I'll see you again soon.